Hi, future Nightingales! I'm Hannah Melissa Apong from BSN2E, and I'm thrilled to be your guide. Let's imagine this. A woman walks into the maternity ward excited for her baby. But unknown to many, her heart is working twice as hard. Why? Because pregnancy, while a beautiful journey, demands a lot from the cardiovascular system. Today, I'll walk you through the essentials of cardiovascular disorders in pregnancy, all backed up by the 9th edition of the Maternal Child Health and Nursing. You can just pause the video for you to better understand what is being presented. I will just give an additional information. To keep it short, hemodynamic burden can unmask latent lesions. Even mild valve disease may become symptomatic as plasma volume peaks. Early recognition such as new onset murmur and unexplained dyspnea and close monitoring prevent decompensation. For the classification of heart disease, this is according to the New York Heart Association. For class 1 and class 2, this is generally compatible with normal pregnancy. For class 3, this may require bed rest or hospitalization in later trimesters. And then for class 4, this has a high risk of heart failure and maternal mortality. Preconception counseling is essential. For the types of cardiac disease in pregnancy, in valve lesions, we have rheumatic mitral stenosis, aortic coarctation. In congenital defects, ASD, uncorrected VSD, Eisenmenger syndrome. Eisenmenger syndrome is the reversal of shunt, which causes maternal hypoxemia and fetal growth restriction. For connective tissue disorders, Marfan aortopathy is the risk of dissection, which increases with hemodynamic stress. Serial imaging recommended. Lastly, peripartum cardiomyopathy, new onset heart failure in late pregnancy or postpartum. Now, let us differentiate the left-sided heart failure and then the right-sided heart failure. Again, you can just pause the vid for you to better understand the pathophysiology, clinical signs, and risks of the two. For the left-sided heart failure, semi-Fowler's positioning and judicious diuretics such as furosemide alleviate symptoms while maintaining uteroplacental blood flow. Anticoagulation may be needed if severe mitral stenosis predisposes to atrial thrombus formation. On the other hand, right-sided heart failure needs for us to monitor the liver size and enzymes, as sites may necessitate periodic parasynthesis. Then, supplemental oxygen and diuretics reduce preload and relieve symptoms. Assessment of cardiac disease. Aside from history, physical exam, and diagnostics, we have to compare the nail bed refill and pulse at each visit. Also, a new holysystolic murmur warrants urgent echo to assess regurgitant lesions. For the fetal assessment, so this is where maternal hypoperfusion leads to placental insufficiency, then fetal acidosis and growth restriction. With that, fetal Dopplers or umbilical artery help quantify placental blood flow. Okay, so for the nursing diagnosis and intervention, SMART goal example is that patient will verbalize 3 danger signs and corresponding actions by end of teaching session. Besides the monitoring, positioning, and paid management on the intrapartum nursing care, some women may require Swan-Ganz catheter for direct hemodynamic monitoring. I will just insert a picture of what that looks like. Avoid oxytocin bolus. Use slow infusion to prevent abrupt hemodynamic shifts. For postpartum nursing intervention, besides from the hemodynamic shift, surveillance, support, you have to note that has the highest risk for decompensation in the first 2 hours postpartum. You have to educate on signs of fluid overload before discharge. Now let's have a quick quiz. So for every question, I will give you 5 seconds to think of the answer. First question, which NYHA class indicates symptoms with less than ordinary activity? Final answer? Class 3. Second question. At what gestational age does blood volume peak? Final answer? 28 to 32 weeks. Last question. Name the first line antihypertensive and chronic HDN of pregnancy. Final answer? Methyl dopa. Congratulations, future Nightingales, and thank you for watching this video lecture. I hope you learned something. Bye!